older adult mental health problems in Pakistan. Next slide, please. So neighborhood domain, like it's a key domain of social determinant of mental illness, as it covers area or community that conveys or act as a protective factor from mental illnesses, such as clean water and sanitization, renewable energies, recreational activities, access to healthcare sectors, as well as food safety. These all determinants are the contributing factors towards good health and well-being. So in order to explore that, next slide, Mr. Amin. As you know, we are in the process of doing systematic review. So now we are doing systematic review in order to explore the risk factor as well as the protective factors of mental health of older adults in Pakistan, as well as interventions that are potentially useful to reduce mental disorders or distress among older adults in Pakistan. Next slide, Ms. Amin. So for this, now I'm going the preliminary findings from 3 databases. We screened 81 studies, out of which 3 met our inclusion criteria. Next slide. So our preliminary findings, our first finding is on family system. As we all know, family system plays very important role among the mental health, as it acts as a risk factor as well as protective factors. Studies shown that people who live with their family members or in a family system are more resilient and less prone towards death, anxiety, and depressive symptoms as compared to those who live in old care home centers. Our another finding is on role of urbanization. Urbanization promotes nuclear family system, as we all know, which decreases the care and the support which is needed by older adults. And our third finding is on implication of research findings. We all know that research has implications for mental health peoples as well as who are the sufferers. So it has also the positive implications for stakeholders as well, such as care professionals, hospice care workers, and policymakers. Thank you.
Thank you so very much, Ms. Sehrish Tofique. Now I would request Professor Mowaddat Rana to please lead the discussion for this particular domain. Professor Mowaddat Rana.
Thank you very much. 3 important papers. We're still, I think, looking forward to some policy initiatives being discussed on the issues that have been raised so far. We were missing Brigadier Munawar and Major Bas Saab from Alzheimer's Pakistan Rawalpindi chapter. And they've been involved in the process of care of the elderly for decades now. So can we request both of you, sir, to actually contribute towards this aspect and some of the themes that we have covered so far in our talks?
Oh, yes, Dr. Saab, thank you very much. Both of us are here, and we are all here since the morning, listening to all the all the important buzzwords which are there. Yes, a lot has been said, and a lot has been said very well. What we would like to say, and perhaps Nia Basit may like to say, add to this, but our joint views on this subject are as what will come. Basically, what we think is that there's a lack of a scientific approach amongst our families to this problem. And whereas there's a lot of care and intent to care, as you said, and people want to take care of the elders, but the scientific approach is missing. And that is because the interaction between the academia and all the other people and the common people who are going to finally implement them, that is scarce. So whereas our doctors and our caregivers and our higher up people know a lot and have a lot to pass on, but it is not getting down to them. And it is not getting down to them for various reasons. Of course, we don't want to discuss those. But the issue is just that they are not getting into this scientific approach of caring, which would make their work much more better and which would make the care much more effective. And we can say that one reason for that could be that in our rural areas, a lot of reliance is placed upon other non-scientific approaches like the spiritual approach. कि ठीक हो जाएगा, किसी के पास जाओ, महज दुआ करा लो या दम दुरूद करा लो, इस किस्म का करा लो. So it may become better like this. And they are not aware that there are so many things which can be done through proper schooling of how to take care of the elderly, because we deal with basically caregiving. So that is one thing that we see which is lacking. The other is that we see is that there's a lot of family connections in the country, and people do operate upon joint family systems. That is true, but we also see a breakdown of that, and that breakdown, of course, takes place more in the town communities and less in the rural areas. But even in the rural areas, this is observed that a lot of breakdowns taking place, because the young people and the young men and the young women, they look outside the village and the community for their livelihood, for their interest, and so on and so forth. And one of the reasons for that is the explosion of this media thing, which is there in everybody's hand now. You know, everybody's connected to the whole world. So therefore, that breakdown is there. So the interests of the younger people or the people at home to be mentally focused on looking after the elders as one of the big purposes of life, or one of the main things of life, that is breaking down, and that has come down, and that they don't have enough time to do that. So as a result, the elders, they suffer. They know they're suffering, and they want to say something, but then that is at the cost of holding down those people from doing their bit. So this is the thing that we see, and of course on top of that we do see that the general issue of awareness, you know, which of course covers as an umbrella term the entire thing, that people at home, people who are supposed to look after the elderly as caregivers, they are not aware of the entire thing which is involved in caregiving. It is not simply being socially nice to them, or it is not simply being spiritually nice to them and getting all the sawab in looking after the elders, jaise ki hamare mazhab mein kaha hua hai. It is not as simple as that, although it leads to that. But before that, a lot of finer things have got to be done. It is just like our namaz and prayer and everything. There's a ritual, and we know the ritual, and we do that. But the spirit behind that is a bit different. And that spirit behind that has got to be learned. Even religion has got to be learned on a scientific basis. And when I say scientific basis, it means, for example, Alhamd Sharif, we all recite it so many times a day. But if we do not understand the meaning of each word that is there and where it takes us, that entire spirituality will be lost. So there's got to be a scientific approach in almost everything that we do, including spirituality and including caregiving. So these are the words which I can say, and I think maybe Mowaddat Sahab, with more experience on this, can add on to this. Thank you, sir.
Thank you very much, sir. Although you've covered almost everything and every aspect, I would just add one thing at the level of consultation by the professional. I always suggest to my friends and doctors and colleagues that never see the patient alone. You must see the patient and the caregiver as one unit, because caregiver is also going through a lot of stress, and he is also suffering from the pressures that the patient would generate on him. So therefore, the condition of the caregiver has to be assessed at every meeting, because the doctor or the professional will have to administer their treatment through the caregiver. And if the caregiver is not well, the treatment and the management of the patient would suffer. I would like to add this. Thank you very much, sir.
Thank you very much, Mowaddat Sahab. Excellent point made. That when you have a patient of dementia in your clinic, there is one sitting next to him or her. and that is a caregiver. We have Mia Tikoreman sitting here. So would you like to add to some of these thoughts that we've covered so far? Mia Tikoreman sir?
Sir, he was having some difficulties with his audio settings, so I doubt that he'll be able to speak at the moment. I'm still requesting him.
My very dear Afshan Baji is here. She's been a carer to people that I loved most in my life. And she can give us...
Thank you so much, Mowaddat. Thank you so much.
Particularly from a carer's perspective, and in the research that PIL has done on these aspects, could you shed some light, Afshan Baji?
Thank you, Mowaddat. Thank you so much. I think it was a blessing for me to be with them. And then, as Bhai also knows, our Nani Amma was with us as well. So, Alhamdulillah, none of them had dementia or memory loss. But one thing which I would like to say, and I would like to tell everybody, yes, sometimes we do feel that they are demanding, and they are repeating the questions again and again, and they are just sort of, I would say, would want apni thodi si attention. Lekin sometimes it is difficult for the carer that if you have got, you know, like your dadi and your nani, and then mashallah your parents there as well, so us waqt thoda mushkil hota hai, lekin it is difficult for the carers. But what I would say that in our country, if we would like, I would say that we are coming in that stage as well, that if we try to unko thoda sa busy kare, if we would try to make them a little bit busy, if we try to not let them be dependent on as soon as it starts, not to be dependent on anybody, and thoda unko nikalne dein, thoda unko logon ke saath baat karne dein, thoda sa, so then they start feeling as well. I want to give example of my daughter-in-law. Mashallah, her father-in-law is 94 years old, and Alhamdulillah, as I would agree with me, Dr. Nusrat would agree with me, that mashallah, he is very busy, because what it is that he has kept himself very busy, and with, yes, the illness sometimes is there, and with that illness, if the carer tries to go with them on the same direction, and with the approval of what the doctor is giving them the direction, that it helps them a lot. That is just my comment and suggestion. Thank you so much, Mowaddat.
Professor Mowaddat, you're mute.
Okay. We're very lucky to have Professor Imran Chaudhry with us. One of the issues with old age caregiving is that every family is looking for a quick fix in form of a syrup, injection, or a pill. Would you throw some light on what are those areas, how are these areas got to be addressed by the families as regards the medical care or so-called provision of medicines in the elderly?